Hi, everyone. Happy New Year, and I'm pleased to share the Department of Innovation Impact update. Unfortunately, I won't be with you in person at the board meeting, but did want to let you know that we are moving forward and just have a fantastic staff in the Department of Innovation Impact that's doing great things. Also wanted to thank the board for all the support with the launch of the Urban Institute collaboration December. Very much appreciate all of your support. Vesta and Kevin attended in person, and I really speak on behalf of the NDBN staff that were also at the event in person just to say how supportive it felt to have Vesta and Kevin there and travel to be there with us, and really grateful for that. And again, grateful for all the support of the board in general around that collaboration. As usual, dividing my quick update for the board into two sections, impact and innovation, fittingly. In terms of impact, Kelly has been really leading on the research front in terms of Kelly and I will be co-editing the special issue that I talked about of the Women's Health Journal. And this will be the first ever peer-reviewed journal issue devoted to period product insecurity and diaper insecurity. Kelly next week will be leading a webinar that's really raising awareness about this special issue, but also has some national researchers presenting their data as part of that webinar. We are also working hard, again, partnering with YouGov on the Diaper Check 2025, so the nationally representative survey this year really focusing on economic well-being and childcare, the impacts that diaper insecurity has on those two. Kelly and I are also talking about exploring with YouGov options for doing a nationally representative sample around period product insecurity. Kelly has submitted the economic impact study manuscript, as I shared with you last time. It currently is with the American Journal of Public Health. We are very optimistic there. We've gotten some good news. I don't want to jinx it. And Kelly, if you're listening to this, sorry, I had to disclose the journal issue, but we are very hopeful. It's in its final stages that will be published shortly. I did want to note, though, on the economic impact study, based on the last board meeting where Philip had suggested we put those findings together in a one-pager. We did do that, and Melissa shared those with all of you. So we hope that those economic impacts summarized in the one-pager can be useful as the state legislative sessions begin around the country, and that you all can use them for your work advocating as well. In terms of policy, and I know Lacey's going to be doing a deep dive, so I won't spend a lot of time on this, but we continue to think a lot about Medicaid and diaper coverage under Medicaid. Joanne also might talk about this, but we're part of the national network now around prenatal to 5 organizations responding to really protect what families and individuals we're serving under the new administration. And so I'll be part of a smaller group that's leading the response around the Medicaid section of that, and Lacey will be working on other pieces that I'm sure she'll tell you more about. Really thanks to Lacey's efforts here too. We've been working hard with Senator Fetterman's office and thinking about, and actually hopeful that they will continue to introduce or continue with their plan to introduce a bill that would be on the federal level to cover Medicaid, to cover diapers under Medicaid through the Social Security Act. We also have had a chance to partner with HHS Region 1 and had some great traction there, presenting on diaper insecurity and period product insecurity to the women's health directors and public health directors across the region. We continue on the evaluation front. This work is really being led by Lynn in Malaysia. They have successfully have a new draft of the annual member survey that will go out this year. It's been a lot of effort and really great teamwork. Lynn has been thinking a lot about service areas and how we measure the area that are served by members at a county level. We were really hoping to get down to a zip code level to be able to understand the reach and the distribution at that zip code level. And then one of the things that we're doing is working hard to get an overall organizational strategy together and plan and timeline for evaluating our internal initiatives. So for example, how well are our webinars really delivering what members are looking for? What kind of impact are our purchasing programs having? Our mentoring program, our diaper search, grant search assistance programs. And so we are going to be moving to really evaluate those systematically, working across departments to hear from them about what they want evaluated. and really hopeful that that will also help with some of the fundraising initiatives to be able to have really concrete outcomes to share on our programming. In terms of innovation, I'll wrap up here just to highlight some work around grants and conference abstracts that we've been working on. So Tamara's department and our department just submitted this week the Women's Health Call to Action from Melinda Gates that was put out, specifically focusing, if we were to receive those funds, on amplifying our reach and our impact with Black and Indigenous women and girls. Kelly's been spearheading efforts to submit conference abstracts to national conferences where we would have big impact and a big reach. Examples being American Public Health Association, American Academy of Pediatrics, and others. Continuing to partner on the baby bonds world. I'll be writing a blog for them in February linking wealth building through baby bonds with diaper insecurity and period product insecurity. So turning to the Urban Institute launch, just wanted to share some photos. We have a lot more, but you can see Kelly presenting on the research there. I led a panel with a representative from Tennessee Medicaid office, Andrea Luqueta, who's an advocate and policy leader from California on economic mobility, David Radcliffe from the New School. You see Representative DeLauro and Senator Duckworth as well, who were part of the event and provided remarks. I will say that Troy and Tamara and Kevin are quite hard to pin down in photos, but you will see Vesta and Lacey there. That top left photo is the Research Advisory Council, really excited to launch that inaugural meeting of the Research Advisory Council, a group of researchers from across the country doing work in this area and part of our steering committee for the urban collaboration. We will be definitely sharing more as that work continues. So I know I wanted to just end by giving you a quick update on frameworks. The strategic brief was released right after the urban launch on December 9th, and that was really thinking about what are some of the really difficult mindsets that we want to shift, essentially, about diaper need and systemic poverty. Frameworks created a share kit that was used on social media to share out the brief. The key insights I think I shared with you the last board meeting, but really the idea of tough pieces that we have to tackle through framing are the individual blame, people thinking diapers are widely available and not really recognizing the struggles to afford diapers, and then the kind of common assumption that poverty is inevitable. So next steps there is actually frameworks based on the research for the strategic brief has created some test frames they'll be using. They'll be exploring those in focus groups and additional empirical tests, come back to us and then release another brief, and then importantly really be working with NDBN on communication strategies that integrate the results and the research from frameworks. Thank you very much. Again, wishing you all a happy new year, and sorry that I won't see you in person, but want to emphasize really the fantastic staff, my partners, my collaborators in the Department of I&I, Kelly, Lynn, Malaysia. It's been a pleasure to continue all this work with all of them and my colleagues across the departments. Take care.